Hi, my name is Kelsey Simons, and I'm a student at Southwest Baptist University. In this presentation, I will be focusing on inpatient falls, why they happen, and if a fall reduction program or intervention would be beneficial. A fall can be defined as an unplanned descent to the floor or other lower surface with or without injury to the patient. Missouri is actually one of the top leading states for patient injury due to falls in elderly. 1 in 4 adults ages 65 and older will fall this year. On average, of all falls that occur in the elderly population, 20% of those falls result in an injury. The number one related injuries from a fall is a traumatic brain injury and hip fractures. This can be debilitating because it decreases the overall independence in adults. This has become such a healthcare-related problem, they have created a National Fall Prevention Day. This year, it is September 23rd. The good news is, although it is a serious issue, we do have many solutions. This topic is important to me because I see this issue in my everyday career. I work at a rehabilitation hospital, so I personally see the effects from falling and fall-related injuries. This topic is also important not only to patients, but the public as well. Family members play a huge role in the patient's overall health and care. If they are educated just like the patients are, it can help to eliminate unnecessary injuries. This topic is important to the subjects in this review for many reasons. By decreasing the number of falls that occur, it can decrease the injury to the patient, decrease the length of stay, which will decrease the overall medical cost. It can also increase the use of other healthcare resources. If the patient falls and sustains minor to serious related injuries, they are going to need other resources to help them heal and get better. Falls are also a problem to the overall healthcare system. The health cost to our country is more than $30 billion a year in direct medical cost. For my PCOT statement population, I chose inpatients on a medical or surgical unit. The intervention is a fall reduction program in comparison to no intervention. The outcome I chose is the impact on the number of falls during a 6-month time period. This led to my overall question. For inpatients on a medical or surgical unit, would a fall reduction program versus no intervention have a significant impact on the number of falls over a 6-month period? The next step in my search was to narrow it down to 5 articles to best represent my research question. The database I started with was Medline with full text along with EBSCO. The next search terms and Boolean operators I used were inpatient falls and fall prevention and medical surgical unit and injury. This narrowed my results quite a bit and left me with 22 results. To narrow my results down even further, I used the search criteria of full text, English, and publication dates between 2015 to 2019. I wanted the most recent results for relevant data to help evaluate my PCOT question. This led me to 11 search results. From there, I was able to find 5 articles which included 1 Level 1 meta-analysis, 2 Level 2 randomized controlled trials, a Level 4 well-designed, non-experimental design, and a Level 5 case study. There are several reasons as to why I chose each article to support my overall statement. One reason is due to expert opinion. In the randomized controlled trial, the nurses are considered authority in this area since their job deals firsthand with the population. Their judgments are trusted based on their experience in the field. Randomized controlled trials were also used to provide evidence in certain research studies. This helped to reduce bias and produce tools to examine the cause and effect relationship between an intervention and an outcome. This data showed proven statistics which all indicated less falls. The results were also gathered from multiple medical facilities. This allows us to look at a larger variety of data and outcomes. The study protocol for the Pilates reformer exercises was approved by the Institutional Review Board. Informed consent was also obtained for experimentation with human subjects, and the privacy rights of human subjects were observed. In Hicks's literature review, it showed promising effects of hourly rounding on decreasing patient fall rates. Further longitudinal research is needed to establish any sustained effect on decreased falls in acute care. Many of the findings concluded to show similarities between inpatient falls and related injuries. The injury-related hospitalization rate was higher for those with mild cognitive deficits than those without. Patients who are hospitalized with a cognitive impairment are more likely to sustain greater injuries requiring more medical treatment than those who have no cognitive impairment. The more groups and individuals working together to minimize falls, the better the preventative programs are as a whole. There are many different interventions that can be taken into action to help in fall prevention. Pilates exercises that are performed once a week for 10 weeks showed a decrease in the number of falls. This showed improvements in balance and mobility. Another intervention can be taken is hourly rounding. This had a major impact on a decrease in patient falls and injury-related accidents. It eliminates the use of the call light and impatience of individuals. By incorporating the 13 universal fall precautions identified by the AHRQ publication in combination with the top 10 highly effective interventions across all inpatient care units, it can significantly reduce the number of falls. There were a few inconsistencies used within the research results. The time measurements used for each study varied. One study was done throughout the time period of July 2011 to February 2012. During the time period, 560 staff members participated in the research study survey. Another inconsistency was the number of patients used for the research study. One study used 55 patients to discover if Pilates can be beneficial to reduce the incidence of falls. The criteria for the test subjects also varied from study to study. Some research studies did not require the patient population to meet any certain criteria, such as age. One study required for the patients to be 65 years or older. This could affect the test results between studies. For example, if a patient population has over half of the participants at a younger age, depending on their medical diagnosis and status, they are not going to be as high as a fall risk as someone who is considered elderly. Another inconsistency found is the results for which the interventions would be most effective to reduce falls. One study showed that the overall best way and most effective method to reduce falls is hourly rounding. The results of another survey concluded that the most common ways to prevent falls would vary between each individual specialty unit. Keeping hospital bed breaks locked was the only common variable amongst every unit. There were several gaps presented in the research that could potentially lead to problems. The fact that the study relied heavily on anecdotal evidence is the first indication of a weakness. Even though nurses are considered experts in their field, relying only on their personal experience in the survey creates the potential for error. There were also multiple therapists being used in the Pilates study to determine individuals' overall balance and mobility, so the results could be biased. Each therapist may score the patients differently or have different expectations of each outcome. Therefore, the results between each patient could be slightly inaccurate. Despite the fact that the Pilates reformer exercises were only performed once per week, significant improvements in outcome measures were documented after training. At the post-test, subjects stated they felt their improvements would have been even more substantial if the Pilates intervention was twice a week. So it would be interesting to compare Pilates exercises performed once a week to twice a week in future studies. There were several limitations in the 5 articles researched. Hicks's article was simply a review and also used a small sample size. This can limit the overall accuracy of the study that's being done. In the Pilates reformer exercises, for fall risk reduction, there were several limitations. There were no long-term follow-up, which cannot be determined if the positive outcomes seen from the Pilates were still evident 6 months to a year later. Secondly, the participants were not asked to document their falls in a daily log, but rather at the post-test were asked to recall the number of falls they had experienced since the pre-test. So this could leave a lot of room for recall error. In the case study, Community-Based Fall Prevention Initiatives, the sample of the case sites included 3 rural and 1 suburban site. This should be acknowledged because it is reasonable to expect different styles of leadership and may be required for particular groups and can lead to being biased. In conclusion, there is evidence to support that a fall reduction program implemented into inpatient hospitals or units would have an effect on the number of overall falls. When we decrease the number of falls, this can lead to many benefits, such as a decrease in the overall injury to the patient, decreased length of stay, and a decrease in the overall cost. There was not a specific guideline involving interventions for reducing the number of falls in inpatient units, but several studies using a randomized controlled trial and meta-analysis similarly find that many interventions can be taken and put into action to reduce patient falls. Interventions such as hourly rounding has a major impact on a decrease in patient falls and injury-related accidents. Based on research and evidence provided, it is appropriate for inpatient units or hospitals to add multiple interventions to reduce patient falls and prevent injury-related accidents. Thank you for watching.